Welcome to this session of Antihyperlipidemic Agents. I'm Dr. Ahmed Nawaz Khan. Cholesterol, triglycerides, phospholipids. These are the complex macromolecules, and these molecules are of lipid and are known as the lipoproteins. These lipoproteins, they are transported as a complex, and when there is an elevated total amount of the cholesterol or low density cholesterol or high density reduced value of the high density cholesterol, then the coronary heart disease start to develop. What does it mean? That when the level of the cholesterol is increases or the low density lipoprotein cholesterol is increases or high density lipoprotein cholesterol reduced, then these situations, they are associated with the development of coronary heart disease, which are known as CHDs. This hyperlipidemia, this situation which is hyperlipidemia, that means high amount of lipid in the bloodstream, is also known as dyslipidemia, which is simply defined as the elevated total cholesterol, low density lipoprotein, triglycerides, a low high density lipoprotein cholesterol, or a combination of these abnormalities. Hyperlipoproteinemia describes an increased concentration of the lipoprotein molecule that transport the lipid in the plasma. And if the abnormality of the plasma lipid occurs, that results in the predisposition to the coronary arteries, to the cerebral vascular system, to the peripheral vascular arteries disease. Now, there is one more terminology, that is atherosclerosis. This atherosclerosis is referred to the building up of fats, cholesterol, and other substances in the arteries wall. And when these fats, cholesterol, and other triglycerides, they accumulated, they make the plaque, which can restrict the blood flow, and this plaque can burst, trigger a blood clot. So this situation is known as atherosclerosis. This atherosclerosis is considered as a very big heart problem, and it can affect the arteries anywhere in the whole body. How this atherosclerosis it actually happens? What is the reason of the causes? What is the reason of the atherosclerosis? Actually, the risks are the oxidation of the lipoprotein, successive hormones, some immunologic attacks, and some intimal function which are dysfunction, and that gives the problem of the atherosclerosis. And finally, the clinical outcomes include the angina, myocardial infarction, arrhythmias, stroke, peripheral artery disease, and sudden death. Now, this oxidation of the low density lipoprotein actually provokes an inflammatory response, and this inflammatory response mediated by a number of chemoattractants, and cytokines, just like monocyte colony stimulating factor, intercellular adhesion molecules, platelet type growth factors, interleukin 1 and interleukin 6. This lipoprotein disorder can be genetic, can be a primary disorder or a secondary disorder. This and genetic disorder, they are the same. So this lipoprotein disorder, they are classified into 6 categories. So the first, the lipoprotein elevation. The first is the type 1, which is because of the elevated amount of the hormone. The second, which is of 2 types, second A and second B. The first is very simple, that is low density lipoprotein, and the second B, which is a low density lipoprotein plus a very low density lipoprotein, also known as VLDL. The third one is the intermediate density lipoprotein. It's a type 3. Type 4 is very low density lipoprotein, only very low density lipoprotein. And the fifth type is the VLDL, very low density lipoprotein plus chylomicrons. Now one more is hyperlipidemia occurs, that's secondary form. And what happens that its secondary form is actually triggered, or there are a number of classes of the drugs which trigger or elevate the lipid level. For example, the progestins, thiazidics, glucocorticoids, and the isotretinoin and protease inhibitors, cyclosporin, many drugs which actually trigger the lipid level. They the secondary form of the hyperlipidemia. So now stated terminologies which are there in this hyperlipidemia, they are the hyperlipoproteinemia, hypertriglyceridemia, high density lipoprotein, cholesterol, diabetic dyslipidemia, etc. Now the drugs which are used to counter these disorders of the hyperlipidemia, they are known as the antihyperlipidemic agent, also known as hypolipidemic agent, because they will cause the hypolipidemic situation from hyper to hypo. So they are called lipid lowering drugs. So because they lower the level of the lipid and lipoproteins in the blood. Now let's move to the drug which are used as anti-hyperlipidemia. So there is some very important drugs which are used as anti-hyperlipidemia or hypolipidemia. So now the first drug is the Clofibrate. The Clofibrate, which is the ethyl 2,4-chlorophenoxy-2-methylpropanoate. It is a fibric acid derivative which is used in the treatment of the hyperlipoproteinemia type 3, and sometimes they use in the severe hypertriglyceridemia. If you see the structure of this Clofibrate, it is an aromatic homomonocyclic compound, and this compound belongs to a class of organic compound known as the phenoxyacetic acid derivative. That means these compound containing an anisole ring, where the methane group is linked to an acetic acid or acetic acid derivative. So the superclass to which this Clofibrate belongs, it is basically benzenoid, and the class is benzene and substituted derivatives. Subclass is phenoxyacetic acid derivatives. So now this drug is basically used for the type 3 hyperlipidemia, that does not respond adequately to diet. This type 3 hyperlipidemia, which does not respond adequately to diet, is basically dysbeta-lipoproteinemia, and this helps to control the high cholesterol and high triglyceride level. This drug also act to lower the elevated serum lipid by reducing the very low density lipoproteins, which are rich in triglycerides. If you talk about the some more activities, this clofibrate increases the activity of extra hepatic lipoprotein lipase, and finally thereby it increases the lipoprotein triglyceride lipolysis. And there are some chylomicrons which are degraded. VLDL are converted to LDL, and LDL are converted to HDL. So what this chlorofibrate is doing, the multiple activities it is doing. It's increasing the lipoprotein triglyceride lipolysis, which break down the lipids. The chylomicrons, which is one type also, so they are degraded. The VLDL, very low density lipoprotein, they are converted to the low density lipoprotein, and the low density lipoprotein, they are converted into the high density lipoprotein. Now, if we talk about the target, so there are some alpha, they are the alpha receptors which are related to the peroxisome proliferators actually, which are a specific type of target for this chlorofibrate. This chlorofibrate is metabolized in the hepatic and gastrointestinal tract, and it also rapid deesterified or the deesterification occurs in the gastrointestinal tract on first pass metabolism, and they produce the active forms. What is the active form? That is clofibric acid, which is the chlorophenoxy isobutyric acid. This chlorofibrate can be taken with the food, but food decreases the risk of the GI and very important is food decreases the risk of GI side effects, which may be occur due to the chlorofibrate. Now next drug is the Lovastatin. Lovastatin, very important class of drug, and this also known as 6-alpha methyl compactin. Look at the structure of this Lovastatin. It is an aliphatic heteropolycyclic compound, and it belongs to a class of lactones and subclass of delta valirolactones. So overall this compound belongs to a organic compound which are known as the delta valirolactones. That means cyclic organic compound containing an oxane 2-on moiety. This statin is a lipid lowering drug and fungal metabolite which actually derives synthetically from a fermentation product of Aspergillus terreus. Originally, this is named as mevinolin. This belongs to a statin class of medication which actually they are used to lower the risk of cardiovascular disease and manage the abnormal lipid level of the inhibiting the endogenous production of cholesterol in the liver. Broadly we can say because it belongs to a statin class of category, so it inhibits the enzyme HMG coenzyme A reductase, which is hydroxymethyl glutaryl coenzyme, which actually this enzyme catalyzes the conversion of HMG coenzyme A to the mevalonic acid, and it occurs during the metabolic reaction which are involved during the production of several lipids. So Lovastatin and some other drugs which are from the statin class of medications, they include like atorvastatin, very important drug, peravastatin, simvastatin. They are all considered as the first line option for the treatment of dyslipidemia or hyperlipidemia. And if we generally talk about the Lovastatin, is used to reduce the risk of the myocardial infarction, unstable angina, and also need for the coronary revascularization of the coronary system. Generally, this drug is used as a prodrug because it is given as a lactone prodrug. And to produce its mechanism of action, it is required to be converted to the active beta hydroxy form. So it is used in the form of the lactone product, and before it produces its mechanism of action, it is converted to the active beta hydroxy form. And when it is metabolized by the lysosomal hepatic enzyme system, which are cytochrome P450, and the isoform is 3A4. So the major active metabolites present in the human plasma are like beta hydroxy acid of lovastatin. It is the 6-hydroxy, 6-hydroxymethyl, and 6-hylene derivatives. Now, food interaction of this lovastatin, always avoid grapefruit while the patient is having this lovastatin, because the grapefruit, what the grapefruit is doing, it may increase the risk of lovastatin related adverse effect. What type of adverse effect? That is the myopathy and rhabdomyolysis. So what is myopathy? Myopathy is a disease of the muscles in which the muscles fiber, they do not function properly. So as a result, the muscle weakness or the muscular weakness occurs, and so overall it's the disease of the muscles, and in which the muscle fiber, they do not function properly. Now next compound is cholestyramine. You can see the structure of this cholestyramine. How does it look like? It is a kind of polymer, right? It is basically the very typical structure, which is a polymeric group, and it is a macromolecule, and it is not because a very structure, so that name is not there. And overall, it is an anion exchange resin, or we can say it's a macromolecule, anion exchange derivative, or sorry, resin, or it's a biacid sequestrant. So what is this sequestrant? What this terminology is? Actually, the sequestrant are additives which improve the quality and stability of food. So at this time, we are using this sequestrant because the sequestrant, they form the chelates complex with the polyvalent metal ions, just like especially the copper, iron. And after making the complexes with these polyvalent metal ions, they can preservation of the fats which are there in the food. So we can say that these sequestrants, they are the food preservatives. So this cholestyramine is a bile acid sequestrant, or bile acid binding, having the bile activity, and obviously this is an anion exchange resins. So being as this cholestyramine a bile acid sequestrant, it is a polymeric compound which serve actually as a ion exchange resins, and this is very quite hydrophilic. But hydrophilic being as this resin being hydrophilic, but it is insoluble in water. Yet although it is hydrophilic, but it is in water. So this is actually used for the adjunctive therapy to the diet for the reduction of elevated serum cholesterol in the patient with which have the hypercholesterolemia, that is the elevated low density lipoprotein, and they do not actually respond to the adequately to the diet. So in those cases where the patient do not respond adequately to the diet, properly to the diet, so in that cases we use the cholestyramine, which is a macromolecule or bile acid sequestrant. So this cholestyramine form a resin that act as a bile acid sequestrant to limit the reabsorption of bile, which is in the gastrointestinal tract, the reabsorption of the bile acid in the GIT tract. Very interesting point about this cholestyramine, that the half-life of this macromolecule or this sequestrate is only just 6 minutes. Half by within just 6 minutes. Now the next compound, again with having the same nature, that is Cholestipol. This Cholestipol, you can see the structure of this Cholestipol. It is a high molecular weight insoluble granular copolymer of two things. The first is tetraethylene pentamine and epichlorohydrin. So these are the two copolymers of two chemicals. One is the tetraethylene pentamine and epichlorohydrin. It also functions as an anion exchange resin and resin sequestering agent, very similar in a very similar manner to the cholestyramine resins. It is available in the hydrochloride form. It's a very complex molecule that reduces the cholesterol level without affecting the triglyceride, and it is very effective in the treatment of type 2 hyperlipoproteinemias. You can see this is the structure, just like it is the diethylene thyrine triamine, which is the data, which is a constituent of the diethylene triamine, DETA. The second constituent is the tetraethylene pentamine and the epichlorohydrin. This one is the epichlorohydrin and this one is the tetraethyl pentamine. So this cholesterol bind to a number of drugs and nutrient in the gut and inhibit or delay their absorption. This is the side effect of this Cholestipol. It interact first and then inhibit or delay the absorption of number of nutrients and drugs, especially like thiazide diuretics, furosemide and benzyl penicillin, tetracyclines, etc. Also lipid soluble vitamins, just like A, D, E and K. In the same class of these sequestering agents, cholecystyrene is one of very important macromolecule, and it also is one of the more recent addition to the class of this bile acid sequestering agent, and its structure is very novel, and it appears to look like the previous one, the cholestyramine and the Cholestipol. But importantly, it does not possess any chloride ions, just like in the previous one. But strictly speaking, it is not an ion exchange resin, and actually this compound has a good selectivity for both type of the bile acid, trihydroxy bile acid and dihydroxy bile acid. So this is just an example which is very similar to this Cholestipol and cholestyramine.